welcome back. It's Dr. Jen here. Today, we're going to go into some detail about some of the thyroid lab work, so you can use this as a reference. So we're going to explore thyroid binding globulin, which is TBG, in great detail. So thyroid binding globulin is a protein produced by the liver that plays a crucial role in transporting thyroid hormones in the bloodstream. So this is very important to comprehend how thyroid hormones are carried in the body and how alterations in this thyroid binding globulin levels can impact thyroid function. So the actual structure of thyroid binding globulin, it's a glycoprotein, meaning it has carbohydrates, glycans, in addition to proteins. These glycans can affect how thyroid binding globulin's ability to bind to thyroid hormone and other molecules. So thyroid binding globulin serves as a carrier protein for thyroid hormones, primarily T4 and T3. The majority of thyroid hormones in the bloodstream are bound to thyroid binding globulin rather than circulating freely. So if you're going to have more thyroid binding globulin in your bloodstream, it's going to bind up more. We also see this with sex hormone binding globulin with relation to our hormones, our sex hormones, and sex hormone binding globulin is increased by birth control. So back to thyroid binding globulin has a high affinity for thyroid hormones, meaning it binds tightly to them. And this binding helps protect the thyroid hormones from rapid metabolism and excretion. So this ensures a stable supply of thyroid hormones to target tissues. So the role of thyroid binding globulin and thyroid hormone transplant, binding and releasing is really important. And thyroid hormones are lipophilic, fat soluble. And as such, they cannot dissolve in the watery environment of the bloodstream. So the thyroid binding globulin provides a means for these hormones to be transported safely through the bloodstream by binding to them. When they're bound to thyroid binding globulin, thyroid hormones are shielded from degradation and released gradually as needed. Thyroid binding globulin helps maintain a stable concentration of thyroid hormones in the bloodstream. And this acts as a reservoir. It stores extra thyroid hormone when levels are high and releases them when thyroid drops. Pretty cool how our body can work like that. This ensures that the cells and tissues throughout the body have a constant supply of thyroid hormone to regulate metabolism and other functions. And this can be important in women that are newly pregnant. This can be important if someone is really stressed in times of fasting, illness, or if you forget a dose of thyroid medication, if you're like me and had to have thyroid surgery. So there's many different factors that influence thyroid binding globulin levels. The first is hormones. So estrogen in particular can influence thyroid binding globulin production. Elevated estrogen levels, such as those seen in pregnancy or taking oral contraceptive pills, can increase thyroid globulin production already. This also can lead to a higher percentage of bound thyroid hormones. And this can result in symptoms resembling hypothyroidism despite normal levels. So this is a problem and seen quite often in women that have estrogen dominance like symptoms, and they're having problems like with their liver health also. So because thyroid binding globulin is produced in the liver disorders can damage and impact their levels. Liver diseases may lead to decreased thyroid binding globulin production, and this could affect the transport and availability of these thyroid hormones. Some individuals may have variations in their thyroid binding globulin gene that affect the structure and function of the protein. And this can also lead to altered thyroid hormone transplant. Medications such as steroids can influence the thyroid binding globulin levels. These drugs can increase the thyroid binding globulin production, and this is going to lead to changes in thyroid binding and availability. So when we're testing thyroid function, we can test the total thyroid hormones, which include bound and free, and then the thyroid binding globulin levels can influence these measurements. But to get a more accurate of thyroid function, the free thyroid hormones are usually measured, and that's what I like to measure. For estrogen and then pregnancy, we touched on estrogen a little bit. It's important to understand the impact of estrogen and pregnancy on thyroid binding globulin levels when interpreting the thyroid function tests. So if pregnant individuals or those taking those estrogen containing medications like birth control which has conjugated equine estrogen, thyroid function tests may show a total hormone level elevated due to increased thyroid binding globulin, even if the thyroid function is normal. So this is where the free levels come into play. And it's also why pregnant women are told to increase their thyroid dose by sometimes up to 25% right when they get a positive pregnancy test, because they're going to be making more estrogen, and then more sex hormone binding globulin, more thyroid binding globulin hormone. So more of that free thyroid floating around is going to be taken up. And if you're not producing more on your own, or you can't, you're going to have to increase your levels. So now let's talk about another lab, thyroid anti-TPO, thyroid paradox antibodies. So thyroid peroxidase antibodies, also known as anti-TPO antibodies, these are really important to me because they're elevated in Hashimoto's. So first, let's talk about the structure and function of thyroid peroxidase. So this is TPO we're going to be referring it to. It's an enzyme found primarily in thyroid follicular cells. It plays a central role in thyroid hormone synthesis. It's essential for the ionization and coupling of tyrosine, that amino acid, residues, and thyroid-binding thyroglobulin molecules, leading to the formation of thyroid hormones, including T4 and T3. TPO is located on the apical membrane of thyroid follicular cells, where it catalyzes the oxidation of iodine ions, I- to iodine, I2, and their subsequent attachments to tyrosine residues within the thyroglobulin. So anti-TPO antibodies are antibodies produced by the immune system against the enzyme TPO. And these antibodies target and attack the TPO, leading to destruction and impairing its function. So when we have autoimmune thyroid diseases, these elevated levels of TPO antibodies are hallmark of these autoimmune thyroid diseases, particularly Hashimoto's thyroiditis and Graves' disease. You'll see them elevated also. These conditions involve the immune system mistakenly identify these thyroid antigens, including TPO, as foreign invaders and mounting an immune response against them. And a lot of time this happens due to molecular mimicry, to disruptions in the gut microbiome, parasites, mold, the list goes on and on. So why is this significant? Well, in Hashimoto's thyroiditis, which is the most common cause of hypothyroidism in the United States, TPO antibodies play a central role. They lead to the destruction of the thyroid follicular cells, resulting in a decreased thyroid hormone production, and then you get hypothyroidism. And these high levels of antibodies are associated with this condition. And what we want to do is reverse that and reduce those antibodies and get our body to stop attacking itself. And that's what's so important. And yes, this can be done, because a lot of the times endocrinologists are saying it can't, and it can. So what about in Graves' disease? So while the TPO antibodies are more associated with Hashimoto's, they're also present in Graves' disease. I see this all the time. Graves' disease is an autoimmune condition, and it's characterized by hyperthyroidism. So in Graves' disease, these TPO antibodies may not have a direct effect on thyroid function as they do in Hashimoto's, but their presence is still there. So how do we diagnose and monitor these? So the TPO antibodies are usually measured by good providers that are really great at diagnosing thyroid. They're measured along with other thyroid function tests, such as thyroid stimulating hormone, TSH, free T4, and free T3. And elevated TPO antibody levels, they often indicate an autoimmune thyroid condition, even in the absence of symptoms, because your thyroid is compensating for this. So you may not have the symptoms of hypothyroidism yet, because you haven't disrupted and destructed enough of the thyroid tissue. So sometimes it goes underdiagnosed until you have the actual hypothyroid symptoms. And that is not too late, but late. And then you might not be able to get off the thyroid medications. So thyroid ultrasound can also reveal structural changes in the thyroid gland associated with autoimmune thyroid diseases. In Hashimoto's, for example, the ultrasound may show a diffusely enlarged thyroid with this heterogeneous texture. And when I see a heterogeneous appearance on the ultrasound, it's almost always associated with Hashimoto's thyroiditis. So clinically, high levels of TPO antibodies in thyroid Hashimoto's thyroiditis can lead to a gradual decline in the thyroid function. This is resulting in the clinical diagnosis of hypothyroidism. And patients with elevated TPO antibodies, when their thyroid is burnt out and destructed, then they might have to take thyroid hormone replacement to maintain normal thyroid levels. In some cases, individuals with elevated TPO antibodies may transition from hypothyroidism to hyperthyroidism, especially if they have Graves' disease. And this transition is due to fluctuations in the autoimmune activity and the thyroid hormone levels. It's almost like the swinging between Graves and Hashimoto's, hyper and hypothyroidism. I also see that a lot in practice. Now, in pregnancy, elevated anti-TPO antibodies in pregnant women may increase the risk of thyroid function during pregnancy and postpartum thyroiditis. And this, you will definitely need proper monitoring once a month thyroid function tests. And if you are pregnant and you have a history of thyroid disease, or even if you don't, selenium, 200 micrograms postpartum is recommended. And there has been studies showing that that helps reduce the autoimmunity. So now let's talk about thyroglobulin antibodies, known as TGAB. They're also known as thyroid globulin binding antibodies. So these are what antibodies to what we talked about earlier. So thyroglobulin is a large glycoprotein produced by follicular thyroid cells. It serves as a precursor for thyroid hormones, T4 and T3. Thyroid hormones are synthesized with thyroglobulin molecules by incorporating iodine into the tyrosine residue. And then these thyroglobulins, they also store the thyroid hormones in its structure. So then they carry them in the blood. And then when they're ready to use, they're released. So for autoimmunity, elevated thyroglobulin antibody levels are associated with autoimmune thyroid diseases, particularly Hashimoto's. And in Hashimoto's, the immune system mistakes these thyroid antigens, including thyroglobulin, as foreign invaders and mounts the immune response. So for thyroglobulin antibodies, this is detected often in patients with Hashimoto's thyroiditis. And this autoimmune condition is what leads to the hypothyroidism. And the thyroglobulin antibodies also contribute to the destruction of thyroid follicular cells. This is similar to the TPO antibodies also. Now, this lab work is also important for thyroid cancer monitoring. And in thyroid cancer patients who've undergone a thyroidectomy, which the thyroidectomy is a surgical removal of the thyroid gland, thyroglobulin is used as a tumor marker to monitor disease reoccurrence. However, the presence of thyroglobulin antibody can interfere with the accuracy of the thyroglobulin measurements. So patients with detectable thyroglobulin antibodies levels may require specialized thyroglobulin assays that are less affected by the presence of thyroglobulin antibodies. And what I believe is that you need to reduce the autoimmune disease and fix it. So in summary, thyroglobulin antibodies, also known as TGAB, are autoimmune antibodies produced by the immune system that target thyroglobulin, a crucial protein involved in thyroid synthesis. Thyroglobulin antibodies interference can affect the accuracy of thyroglobulin measurements, and this is more particular in the context of thyroid cancer monitoring. So if you are out there, you're listening to this, and you are concerned that you have something going on with your thyroid, get a full panel. Okay. Make sure you're getting TPO, make sure you're getting anti-thyroglobulin antibodies. So then you can make changes to your lifestyle before you have that follicular cell disruption. If this was exciting for you, if you want to learn out more, if you want me to be your coach, if you want to be my patient or client, please reach out for more information and I will help you as much as I can. Please subscribe and share this information far and wide.